Good afternoon, everybody, and welcome to our NCCT MOA Prep session. We are going to finish up the communication section today, and then we are going to break next week and then continue on the week after that. Okay, so I will share the link if there's a new one the day of when we start that next section. All right, so let's go ahead and get started. We're going to start with number 45. And it says, which tasks are necessary after transcription and before a letter is sent out? And it says select 3. So let's go through these. Proofread the letter. Absolutely, you want to do that. The scribe signs the letter. I don't think that's necessary. Spell check. Definitely. You want to make sure everything's correct. Check the grammar. Absolutely. And add MOA addendum onto letter. I don't think that's necessary either. So I'm going to go with proofread, spell check, and check the grammar. And again, remember, guys, that was correct. A lot of these in the communication section, or you can rule them out, and a lot of them are kind of common sense. Which is a machine that records spoken words from a medical provider so that the information can be played back later for transcription? A, copier scanner, B, record player, C, keyboard, or D, dictaphone. And I do believe that is going to be D, dictaphone. Your answer is correct. A dictaphone is a machine that records spoken words to be played back later for typing by transcriptionists. They have a foot pedal to control when the dictation machine starts, stops, and how fast it plays the recording. The other options don't fit this description. See, again, you can do, you can rule them out, the ones that don't apply. What is the title of someone who listens to the medical provider's recording and types the information into a letter or other medical documentation? All right, let's see. A, medical writer. B, rad tech, which is a radiation technologist, if I'm not mistaken, a transcriptionist, or a recorder. It is going to be a transcriptionist. They also have transcriptionists in courtrooms and things like that. People who literally record what somebody says and then types it into notes for a record, whether that be a court case or a medical record or something like that. And guys, you can get jobs as transcriptionist. We actually at Unitech, last year we were working with a company that was hiring scribes to do remote work. So if you are interested in that, maybe get with your instructor and see if we can get that information. Your answer was correct. All right, next question. When should the MOA proofread and edit office correspondence? A lot of repetition in here, right? A, for every office correspondence. B, only before sending out a letter that is over 2 pages. C, proofreading is unnecessary. Or D, spell check is enough before sending out a letter. I'm gonna, you know me, I'm gonna be more cautious for every office or correspondence. Correct. Excellent. Which term is described as finding and correcting mistakes in written or typed text, such as letters, documents, and articles, before it's printed or posted online? Reading, scanning, proofreading, or abstracting. This is going to be proofreading. Going through and finding mistakes and things like that. We're proofreading our correspondence to make sure it says what we need to say and it's correct and it's professional. Which term is described as reviewing written or typed material to prepare it for publication by correcting, rewriting, or reformatting the text, punctuation, and grammar? All right, A, abstracting, B, editing, C, modification, or D, completion. As reviewing written or typed material to prepare it for publication by correcting, rewriting, or reformatting text, punctuation, and grammar. I'm going to say, I think it's going to either be editing or abstracting. I think it's going to be editing, though. That's what I'm going to go with. Correct. All right, excellent. Does the computer spell check understand the differences between and when to use which homophone, such as to, to in context. So you see what they're saying there. The different spellings of the word to mean different things, right? So does the computer spell check understand the differences? Yes, in any context. No, if writing a letter. Yes, corrects to the right one. No, it does not know the difference. Computer spell check. I'm gonna have to guess at this one, guys. I'm gonna say yes. I want to say that I've had it correct me on something like that before. Corrects to the right one. No, it doesn't know the difference. Okay, so it's up to us to know the difference between the different spellings of certain words. Which is the most appropriate way to mail a letter from the clinic that contains PHI? A postcard? No, not at all. Certified mail, standard mail, cornered mail. I'm not sure what cornered mail is. I would go certified mail. Anything that needs to be secure, you ought to send certified to make sure it gets to the person it's supposed to go to. Correct. Which is the least appropriate way to mail a letter that contains PHI? And it's given us, almost those exact same options. And of course, the answer is going to be postcard. You cannot put anything on a postcard, guys. That's just crazy. Anybody could read it anywhere. All right. Accurate reasons to have a patient check out after a completed medical exam include which of the following? And it says select 3. To have the patient leave with a positive impression. That's possible. To demand the patient pay his or her total bill immediately. We're not going to demand. Demanding is rude. To request the patient's phone number for a date. I don't think we're going to do that either. To schedule the patient for a follow-up appointment. Absolutely. To collect any additional payments due from the patient. That's correct. And I'm going to pick the impression one. Yeah, those 3. We're not going to ask the patients on a date. That's inappropriate. And we are not going to demand anything. That is not our job. All right. Which is an example of a template from the medical office used for a patient excuse? Time off work to heal, excuse from bank interest, time off from hygiene, excuse from creativity. I would say time off work to heal. Those other ones almost don't even make any sense. What is the correct term for when a medical provider requests or directs a patient to see another provider, such as a specialist? All right, so anytime your doctor recommends you to somebody else, it's called a what? A referral, right? If the MOA is asked to schedule an appointment for a patient with another medical provider, what should also be done? Give the patient directions to the nearest restaurant, obtain pre-authorization from insurance for the new doctor. Other considerations are unnecessary for this arrangement. Ask permission from both the office manager and lawyer. Okay, so what I'm gonna pick on this one is obtain pre-authorization from the insurance for the new doctor. You don't want to send your patient somewhere that their insurance is not gonna cover. And obtaining this pre-authorization, this is not a guarantee of payment for the other doctor or coverage for the patient. It's just saying that, yeah, this doctor is in network and you can see them and whatnot. If there is a legal reason to stop treating a patient, what must the medical provider do first? Let's see what our options are. The medical provider must write and send a certified letter to the person. Lock the front door to the office when the person comes for an appointment? No. The medical office assistant must talk alone with the person to say goodbye? No. The office accountant should handwrite a farewell note to the person's bill? No. So see, B, C, and D don't even make any sense. So we're going to send a certified letter. And that is what you do. If you're not going to treat a patient anymore, your provider is going to need to send them some documentation explaining that they are not going to treat them anymore, and as to why they are not going to treat them. Right. Acceptable reasons for terminating a patient-physician relationship include which of the following? Okay, so this is, the previous question was, what do you do when you do this? And this is acceptable reasons for terminating your, not seeing this patient anymore. A, the patient's race, religion, or sexual orientation. And wants us to select three. So no, that is not, no, you can get sued for that. Do not discriminate. That's called discrimination. We don't do that. B, patient using abusive language or behavior. Absolutely. We do not have to put up with anybody's abuse, verbal or otherwise. And you just always, you remain professional regardless of what the patient does. Safeguard yourself. You remain professional. Let the doctor, security, whoever handle that stuff, okay? All right, patient demanding unreasonable amounts of opioids. Absolutely. If they are exhibiting drug-seeking behavior, that doctor may cut off seeing that patient. D, patient's non-compliance with their treatment plan. Or E, patient's highest level of formal education. So E would again be discrimination, and we're not going to do that, right? So D, if the doctor is trying to treat the patient and the patient does not want to do the things that the doctor is recommending, the doctor can say, okay, if you're not going to take my wise counsel, my good advice, I'm not going to waste my time. I'm going to spend my time with someone who is someone who is, that I can help, basically. Answer is correct. All right. Next one. What should be done with the copy of the termination letter and signed confirmation from the patient? A, both papers are unnecessary for filing. That's not true. B, file the letter, shred the confirmation. I don't think so. Shred the letter, file the confirmation. I don't think so. File scan both letter and confirmation. That's correct. You're going to put them in that patient's file so that it's documented, right? Because if it's not documented, it didn't happen. Excellent. What time considerations should be recognized when terminating a patient-physician relationship? Oh no, I'm not really sure what they mean by time consideration. Let's go through our options and see what they say. It is official exactly 1 day after the person receives the letter from the medical provider. Okay, so it is official exactly 1 year from the person's last visit to the medical provider. The notice should be sent far enough in advance so the patient can find another doctor. I would say that one. Or D, the notice must be sent exactly 2 months before the patient sees another doctor. I don't think there's like a set time frame. I think it's going to be up to you, the patient, to notify the patient far enough in advance so that they can find another doctor. I think that's what we're going to go with. Correct. All right. We're 62. Managing patient informational materials includes which items? A, the doctor's medical books. B, pamphlets and education pages. C, the local university library. Or D, redacted patient charts. All right, so managing patient informational materials includes which items? I'm going to say redacted patient charts, because we're not going to mess with our doctor's medical books. Patient informational, I don't know if that applies to pamphlets and education pages, and the local university library is not going to have anything to do with this. It was pamphlets and education pages. All right, so let's see why. The office may have printed pamphlets, brochures, or papers that have patient education information available, provided by the office, the hospital administration, or public relations office, the Centers for Disease Control or the CDC, the state health department, or from pharmaceutical companies. The educational material should not come from the doctor's medical books. Too technical for the average person. Okay, I was misunderstanding the question. Redacted patient charts may still violate HIPAA. and the local university library usually does not provide information to clinics. Okay, so I misunderstood the question on that one. So sorry about that. Medical office educational materials are available for which topics? Office policies and procedures, local travel and entertainment, descriptions of every known disease, and recognized worldwide holidays. I'm going to say office policies and procedures. And tell us to pick three, does it? All right. Answer is correct. 64. Which are appropriate groups or organizations to have provide patient educational material for a medical facility? Select three. Okay, so we just read that rationale on that one I got wrong, right? So now it's asking which are appropriate groups to provide patient educational material. So clinic or hospital public relations, office supply companies, probably not. The Centers for Disease Control or the CDC, pharmaceutical companies, and a blog managed by acquaintances, definitely not. All right, so those are the three: clinic, the CDC, and then pharmaceutical companies. Your answer was correct. See, even though I got that one question wrong because I misunderstood what they were asking for, I still was able to get another question right because of the answer. All right, patient educational materials should be reviewed for which of the following? A, favorite office jokes or slang, black and white background only, correct and up-to-date information, using only second grade level words. Okay. I'm going to go with correct and up-to-date information. The rest of this stuff is not jokes and slang. We're not going to want in there. It doesn't matter if we use second grade level words, and we don't care what colors the background are. We only care about the content, that it's up to date and accurate. All right, very good. We do just a couple more, then we're going to wrap it up for today, guys. Which U.S. federal government department provides resource lists for patients? The EPA, the USDA, CMS, or the DoD? Okay. Not everybody's going to know every abbreviation what they pop up with, but I can tell you right off the top that the EPA is the Environmental Protection Agency, and they're not going to have anything to do with our medical patients. Okay. The USDA, the United States Drug Administration, I believe. So that could be one. CMS, the Centers for Medicare and Medicaid. That is definitely going to be the one I'm going to pick because the DoD is the Department of Defense. Also not one that is going to have anything to do with us. So definitely CMS. And if you guys remember, that is a website that I tell you to go to all the time for code updates and news on Medicare standards and things like that. So that's what I'm going to go with. It's correct. 67. A variety of person-centered care, medical, food, utilities may be provided or delivered by which group? HCBS, the USDA, OSTP, and ACUS. And I will be completely upfront and tell you that I don't know because I don't know all of these abbreviations. Medical, food, and utilities. I have no idea. So we're going to guess A and see what it tells us. My answer was correct. HCBS. What is HCBS? There are resource lists from CMS, Home and Community-Based Services. HCBS is Home and Community-Based Services that comes from CMS. In many states that can help patients find help with their medical and utility needs, adult daycare, etc. Okay, so OSTP is the Office of Science and Technology Policy, and the ACUS is Administrative Conference of the United States. Yeah, so neither one of those have anything to do with us. And the USDA is the U.S. Department of Agriculture. I thought it was the Drug Administration. See, I don't know them all either. All right, the MOA may be asked to keep records for running the office, including information on PC inventory, credit card transactions, office keys, and passwords in which of the following places? Let's see, and we need to select 3. In a MOA-owned mobile phone, probably not. In a secure and locked room in the clinic, that sounds like an option. In a locked drawer or cupboard in the office, maybe. In a computer that requires passwords, that's probably one. In a paper notebook on the front desk, absolutely not. I'm going to go with B, C, and D because those are all locked and secured. And that's how you want that information. You don't want that for just anybody to be able to access. Answer correct. Very good. All right, who should have access to the records and details kept for daily activities in the medical office? A, every clinic employee. B, only housekeeping staff. C, the office manager and assigned